Hello everybody. I am Dr. Srinivas, consultant neurologist at Renova Hospitals, Langarhouse. Today I am going to talk about the signs and symptoms of migrainous headache. As we all know, all of us might have experienced headache in their life at one or the other time, most of the time. But this migraine headache is a separate entity where there is some inflammation going on in the blood vessels of the brain. This leads to a variety of symptoms and signs which comes in the form of throbbing type of headache which persists mostly in the frontal area or the parietal area or in the temporal area. Some patients experience occipital headache also. The patients suffering from migraine headaches might have a aura which is called the migraine with aura, and some patients do not have a aura which is called migraine without aura. The aura is the symptoms which patient himself notifies before the starting of the headache in the form of flashes of light or blurring of vision or some tingling and numbness sensations, or in the form of nausea, vomiting, or tinnitus in the ears. These are the type of aura which a patient experiences in different scenarios. Then he experiences the typical migrainous headache where he has a hemicranial headache with a throbbing type of sensation or with a heaviness of the head which persists for around 1 to 2 hours. And as the patient experiences the headache, he feels drowsy and he is irritable, he feels restless, all such kind of symptoms he experiences. Sometimes the patient also feels redness in the eyes and the running nose also he suffers. These are the autonomic symptoms which he suffers. The patient typically complains of relief of headache after a sleep or in the early morning after getting up from bed. Such kind of patients needs to consult a neurologist and start their medicines regularly. There are some medicines which terminate the acute attack and the other medicines which continue the prevention of the headache. So it's called migraine prophylaxis. For all these things, you need to individualize the treatment according to the patient's requirement. So the patient suffering from this migraine headache needs to take their medicines regularly for prevention of further attacks, and during the acute attack there are some medicines which terminate the attack. Also, they need to know that any factor which is triggering this headache is called triggering factors. For this triggering factors, it is individualized according to the patient's complaints, and the patient needs to himself recognize the triggering factors and avoid them. Most of the triggering factors would be like listening to loud noises, or some flashes of heavy lights, bright lights, or after eating some spicy food or any fruits, or if they don't like any unpleasant music. These are the triggering factors. They need to know their own triggering factors and note down them in a book and maintain a diary and note down the triggering factors, the type of headache he is getting, the area and location of the headache, and the duration of the headache, and the symptoms which are relieving his headache. All these need to be notified in a diary. When they come for the review to their neurologist, it becomes an easy job for the neurologist to recognize the patient's symptoms and treatment. And for the better treatment of the symptoms, patient needs to monitor and regularly visit a neurologist.